So this is a typical exam station. Our goal is to do at least a general assessment and especially find out if there's a major concern that the child has that is causing pain or suffering. We like to, if there's time, explore a little deeper and above all instill a sense that we care and want to relieve suffering. We want to give an example that not only do we rely on God, but we hope that they can come to believe that that is their greatest hope as well.
Each patient will come through with an exam form. The front has all of the history and basic assessment information. The back part has the medication administration and prescribing information. Each patient will come through your station with this information stapled to a CSI form. The CSI is a Child Safety Initiative. That's the part of the emotional and social health that we're looking at of a child. So let's step over here to the exam station and let me show you what I love to bring when I go on trips. I like to have hand sanitizer at my table, a flashlight for oral assessments, a portable blood pressure cuff. We always bring a manual blood pressure cuff with us, but sometimes this is a little quicker and easier. I'd love to bring a spot oximeter, a thermometer, an otoscope, a pen, a highlighter, stickers to hand out to the children, tongue blades we usually have with us in the first aid kit of the team. We also have gloves provided for you. This book is a great resource that we have and bring on every trip. It's a dermatology book, so this is available to you as a resource as we're traveling. We always have this with us in the first aid suitcase. When you are at an exam table in the morning, as we set up our things, we always like to attach a garbage bag. You're always having little things you want to put in the garbage. We want to be a good example to the community and not be throwing things on the ground. Another thing to be mindful of are the windows. It's very easy for children to be in the windows and possibly grabbing your things off the table. So just be mindful of where your valuables are, as that is something to watch out for. The children will usually come to you and sit in one chair, you will have a chair, and an interpreter will have another chair. So as we set up these exam stations, we'll typically share a table, so there'll be an examiner on one side and an examiner on the other. This system works really well for us, and just expect the flow to change often. Sometimes we use clipboards, some people prefer to use a table. It varies examiner by examiner. There's not necessarily a right way or a wrong way. It's your way, the way that is comfortable for you to set up your station where everything is accessible and organized so you can see your patients.